together. Now, I just have to show you something. So it's dermatomes, myotomes, and peripheral nerves. I want you to have a look on this picture. Okay. That is the picture of dermatomes as we explained thoroughly for you. Right? But this one, this map, is not the map of the dermatomes. It's not the map of the dermatomes. It's a map for peripheral nerves. I wish you will understand the difference between dermatomes and peripheral nerves. I'm going to try to explain this to you. I'm going to try to explain this to you. Let me try to find a diagram, because pictures, they always say more words before we say them. Pictures, they are good to show you. I want to... Okay, have a look on this. That is brachial plexus. I just want you to differentiate between a nerve root and the peripheral nerve. Okay, this one is musculocutaneous nerve. This is not a nerve root. This is a peripheral nerve. This one is axillary nerve. This is not a nerve root. This is a peripheral nerve. This one is radial nerve. This is not a nerve root. It's a peripheral nerve. Okay, let's take, for instance, the radial nerve to make you understand. What is the difference between the nerve root and the radial nerve? Nerve root is only one nerve root coming from the spinal cord. The ventral root and the dorsal root, they make the nerve root, right? The compression is there when you speak about nerve root. It's only one spinal cord level that is affected there, right? But if you look at the nerve, take for example the radial nerve. Radial nerve is made of 5 nerve root. If you follow the radial nerve, check the radial nerve. The radial nerve is getting sensation from there. You can follow it. It's getting sensation even from C7. Is getting sensation even from C6. Is getting sensation. Is connected even to C5. So the peripheral nerve is the combination. Of different nerve roots, especially those peripheral nerves that are from different plexus, like from brachial plexus or cervical plexus or lumbar plexus. Therefore, we have what we call the mechanical interface of a nerve. Because the nerve are not sitting alone, there are structures along the nerve. We have muscle, we have capsule, we have different structures along the nerve. We have blood vessels, we have bones. There are structures. These peripheral nerves are situated along the other structures. Therefore, there is a degree of mobility of those nerves relative to the structures along those nerves. There is a degree of mobility that is allowed, right? Let's say, for instance, somebody was stabbed at the area of brachial plexus, and then maybe the brachial plexus was not badly damaged, the person got healed, but healing is he will develop a scar tissue. So now the mobility of these nerves relative to the structures around them will be impaired by that scar tissue that has developed because of the healing process that happened there. Now, in order to test the nerves, the mobility of the nerves relative to the structures around them, you will have to be able to understand how many muscles are supplied by that nerve. Let's say if it's not a nerve root now, we are dealing with peripheral nerves. Let's say it's a radial nerve that is affected, not the peripheral nerve, it's a radial nerve. Let's say somebody was drunk and then he slept over the edge of the chair and compressed the radial nerve. If the radial nerve is injured, all the extensor muscle will be affected. Unlike the case of the nerve root, one nerve root. If the radial nerve is affected at the area of armpit, let's have a look here. The nerve was compressed around this area of the armpit. The radial nerve is a supplier of triceps, all three heads of triceps, long head, lateral head, and medial head of triceps will be affected. Supinator muscle will be affected because it's supplied by radial nerve. Brachioradialis muscle will be affected. Extensor carpi radialis longus will be affected. Extensor carpi radialis brevis will be affected. Extensor digitorum will be affected. Extensor digiti minimi will be affected. Extensor indicis will be affected. Extensor carpi ulnaris will be affected. And abductor pollicis longus is supplied by radial nerve, also will be affected. And extensor pollicis brevis will be affected because it's part of the radial nerve. And extensor pollicis longus will also be affected. So when the peripheral nerve is affected, not the nerve root, all those muscles will be affected. Also, there are branches from the radial nerve that supply the skin. If you look here, you look at this map. This is not dermatomes, it's for the peripheral nerve. The radial nerve, this area, when we were doing the brachial plexus, we said the axillary nerve, in terms of myotone, it supplies the deltoid. Right? It supplies the deltoid and the area and the skin on top of the deltoid, and that's why you see the axillary nerve. So if the axillary nerve is affected, not the dermatome, if the mechanical interface of the axillary nerve is affected or the axillary nerve is compressed somehow, there will be, when you test sensation here and you test the strength of the deltoid, both they will be affected. And then you can say it's not a nerve root, but it's a palsy of the axillary nerve. So now you need to differentiate from a problem caused by the nerve root and the problem caused by the peripheral nerves. Right? Okay. I think we can continue a little bit. Let's continue a little bit. I hope you have an understanding of the peripheral nerves. Let me explain to you sensory testing of the peripheral nerve. In terms of the peripheral nerves, The peripheral nerves, when we speak about peripheral nerves, we speak about individual nerves. We speak about ulnar nerve, we speak about median nerve, we speak about radial nerve, we speak about axillary nerve, we speak about musculocutaneous nerve, we also speak about the other sensory nerve that are from the, let's say, for example, when we speak about brachial plexus, we have this nerve, two nerves here. These two are sensory nerve. Medial cutaneous nerve of arm is sensory nerve. Medial cutaneous nerve of forearm is sensory nerve. When that nerve is got a problem, that area of the skin is not a small area like a dermatome. It's a part that covers a big area of your arm will be affected. Let's say, for instance, here, for the hand, you can test from the hand down there, you can test 3 nerves. Right? For the hand. Right? You can test for the hand. If you look at the hand like this, only 3 peripheral nerve you can test there. You can test ulnar nerve, you can test medial nerve, you can test radial nerve. So if you turn your hand like this side of the digit minimi side, like this side, finger 4 and 5, you can test the ulnar nerve. Finger, thumb, second finger and third finger, you can test the median nerve when you look at the palm. But if you turn it around like this, that part, this part, you can still test ulnar nerve there, but on this one posteriorly, sorry, this one posteriorly, you can test a radial nerve. So for the hand, you can test 3 nerve. Look at this. This is the posterior part. This part, this is a radial nerve. This is ulnar. Then if you turn it around, it's still the ulnar nerve, but anteriorly you can test the median nerve. So from the hand, you can test 3 peripheral nerves. Okay. If you catch it the way I explain it, it will be more easy for you. From the area of the wrist joint to elbow joint, you can test 3 nerves there, right? You can test 3 nerves. This nerve, you can see the name of this nerve is medial cutaneous nerve of forearm. This nerve is not a branch from any other nerve. It's a specific nerve from brachial plexus that comes and supply this anterior medial aspect of the forearm. So if this big area, the half of your forearm, there is decreased sensation for the half of your forearm, you can query the integrity of the medial cutaneous nerve of forearm. It's a specific nerve from the brachial plexus. Here is this nerve. This is brachial plexus. If you look at the area of the cords, there are these 2 nerves that I spoke about when I was explaining the brachial plexus. The medial cutaneous nerve of forearm is this one that I'm just mentioning here. When there is a problem with the mechanical interface of this nerve, then you have to query that nerve. And then this one, lateral cutaneous nerve of forearm. This one is not a specific nerve from the brachial plexus. It's a branch from the musculocutaneous nerve. Because remember, when we were doing brachial plexus, we said musculocutaneous nerve. It means that nerve is supplying muscle, is also a sensory part. That branch that is the sensory part is this one that supplies this area. Then if you turn it around posteriorly, you can see in between of these two nerves that I explained, there is this part is still a radial nerve, it's a branch from the radial nerve. I think we need to, the video has become too long. We need to stop here. But I'll just do a quick summary of what we were explaining today. Today we speak about dermatomes. We spoke about dermatomes, and then we spoke about myotomes. And we spoke about dermatomes, we spoke about myotomes, and we spoke about peripheral nerves. How to differentiate, how to test all those things. Dermatomes, myotomes, and peripheral nerves. And then the next video, I think we will speak about the test, because this video has become too long. I think maybe if the video is divided itself, maybe we can continue a little bit and add just a small part. If the mechanical interface of the peripheral nerve is suspected to have a problem, that you can confirm by doing neurodynamic test. That you can confirm by doing neurodynamic test. What do I mean by neurodynamic test? You remember you were taught about upper limb tension test 1, upper limb tension test 2A, 2B, upper limb tension test 3. Those tension tests, one is specific for the ulnar nerve, and another one for median nerve, and another one for radial nerve. Right? So when there is a problem with the mechanical interface of these nerves in relation, when there is tightness in relation to the structures around them, the neurodynamic test will pick up that. And we will do the neurodynamic test, because the neurodynamic test, a physiotherapist will also use the neurodynamic test in order to clear the mechanical interface of this nerve. When they treat this nerve, they will use the neurodynamic test. And then they will use a technique called the slides and tensioners. When they try to tension the nerve a little bit, but not too strong, but tension it in just to help to treat the nerve, and they will also help the nerve to slide the nerve, doing the neurodynamic test as a treatment. When you do the neurodynamic test, you are testing the mechanical interface of the nerve, whether the nerve is not trapped by structures around it. So if there is a problem with the structures around the nerve, then the neurodynamic test will pick that up. And then you will also use the neurodynamic test to treat, to restore the normal mobility of the nerves. I think it's fine now. It's fine now. You will just have to read to listen to this over and over and over. Maybe you will eventually understand what I'm saying. But what is important for now, when you do your neurological examination, think deeply. Whether you are testing the nerve root, when you do your sensation, is your sensation testing the nerve root or is testing the peripheral nerve? If you are testing the peripheral nerve, you don't cover a small specific area. You must know the area that is covered by that nerve. But if you are testing a nerve root by doing sensation, Then you have to follow the dermatome. It's normally from the area of the spinal cord right around. That is what we call a dermatome, right? And then if you are doing myotone for the nerve root, you will follow that pattern that I explained, where C1 you test upper cervical flexion, C2 upper cervical extension, and so forth. I did explain it in the beginning of the video. But if you are testing the peripheral nerves, you will have to do the neurodynamic test to check the mechanical interface of this nerve. If there is problem with the mechanical interface, you will have to clear the mechanical interface by treating that nerve using the very same neurodynamic test as tensioners and slides. And remember, when you do your neurological examination, remember about your precaution and contraindication. Because if both sides are affected, it tells you that this is not just the peripheral nerve or the nerve root. Something is pressing around the spinal cord. So it's one of your red flags. Anything that affects both, then you need to think twice. Anything that affects bowel control, causing urinary incontinence, struggling to feel around the area of genitals, then is one of your red flags. That patient might have something big compressing around the spinal cord. Just for another thing to clear this thing of the peripheral nerve. A patient presents with a sciatica, pain along the area of the sciatic nerve. There are two possibilities there. It's either the sacral plexus, there is problem right at the sacral plexus, or the nerve root of the sacral plexus. One of them is got a problem. Or we know that the sciatic nerve sometimes is situated along the area of the piriformis, and sometimes is, for other patients, is going through the piriformis. So when the patient has got a problem with the piriformis will compress that nerve, and that one, the neurodynamic test will pick up that this is a piriformis. Because when you try to stretch the piriformis, the same pain, you will get the same pain. So you need to be able to differentiate whether the pain is from the nerve root or is from along the mechanical interface of your nerve. Okay, thank you. I think we'll end here. Thank you.